go by the municipal. We now go by the Municipal Health Insurance Consortium. We've kind of shortened our name now that we've really expanded our region that we cover. We offer health insurance to across 16 different counties. In 2026, we will be up to 88 municipalities that we offer their health insurance to their actives and their retirees. And we're continuing to grow. So we're getting rather large, which is wonderful. And I was asked to come back out and present information about the Medicare supplement plan, the MS3. That has been available in the city of Cortland's plan offerings all of this year. And now it looks like it will be available next year. It is an option for retirees who are 65 and up, who have Medicare A and B. So we're gonna kind of go through that. I'm pretty informal. You're never interrupting me if you have questions. Please just, yes.
Sorry. So the statement you just made kind of concerned me. It looks like it's gonna be available this next year.
So nothing's decided. I've learned this last time. Nothing's decided until it goes in front of city council. So last time I said, this is what they're telling me you're offering, and they're like, until city council votes on it. So I've learned my lesson. And we offer it. Yes, it is not going anywhere. Yes. But city of Cortland decisions are made by city council. So that is why I worded it that way. And I will reiterate this as we go through. Health insurance can get really personal really quick. You might want to ask questions about certain medications. You might want to ask questions about treatment that you're going through that no one else in this room knows about. That is why I'm giving you my direct phone number. That goes right to me. This is my direct email. Please don't put protected health information in an email unless you're encrypting it. But call me. If you have those very personal questions you want to ask, you're more than welcome to call me directly. The other thing is sometimes when I talk health insurance, the person who knows more about health insurance may not be sitting in the room. They may be at home. So if your loved one at home has questions, they can call me too with your permission to talk to them. So just giving you a heads up on that. So before we kind of dive into talking about health insurance, I just want to make sure we're on the same page of what a premium is, what a deductible is. So a premium is the amount you pay every month to just have the health insurance. A deductible is the amount you must meet before health insurance kicks in. So for example, on Medicare Part B, starting in 2026, their annual deductible is $288. You have to meet that, then Medicare covers it 80%, leaving you with 20% to either go to another insurance or for you to pay. Co-insurance is a percentage of the visit you pay. So that 80% paid for by Medicare, the 20% is what you owe, a percentage of the visit. Now that 20% can get picked up by a Medicare supplement plan and things like that. We'll talk about it in a minute. Versus a copay, which is a set dollar amount you pay for that visit. I'm not paying 20% of the visit. I'm paying my $15 or my $25. That's what a copay is. Out-of-pocket maximum takes those co-insurances, those deductibles, those copays, puts them all together. And once you reach your maximum out of pocket, you have 100% coverage for the rest of the year. I'm saying all this because when we start talking health insurance, I'm going to use these terms, and I just want to make sure everybody's on the same page of what these terms mean. So when you're on Medicare, it's going to be a very short Medicare 101 class here, real quick. When you're on Medicare, you can go one of two paths, okay? You can go the path on the left, and you have original Medicare, and then you do add-ons, okay? You can do an add-on Part D, you can do a Medicare supplement, or you can go the path on the right and pick up a Medicare Advantage plan. Medicare Advantage plan replaces your A, B, and D, and that's your card. And we'll talk about those differences, but I want to make sure you know it's one path or the other. You can't mix the paths.
Question.
Yeah.
So if I understood you correctly, we don't have Medicare, we go to the supplement plans?
Actually, it's the opposite. So when you have Medicare, right, you have your red, white, and blue card, and then you pick up a Medicare supplement plan like our MS3, it supplements your Medicare. You still have Medicare, you still have your A and B, and then it picks up the balances after original Medicare. Where you're wondering if you still have Medicare is probably the Advantage plan, right? So the Advantage plan replaces your original Medicare. Still have Medicare. Right, so I'm comparing all three. Yep,
Thank you.
Are you with MS3?
Yes. so I represent the consortium. And we cover the health insurance for the city. And we offer the Medicare supplement plan. We do not offer Medicare Advantage plans. That's through Excellus separately. Yep. But I will go over the differences in the benefits, just so you can kind of get the full picture of what the differences in the plans are that are being offered to retirees. But any very specific questions for the Medicare Advantage plan, I'd send you back to their rep to ask those. So real quick, what are the parts of Medicare? A lot of people just assume it's all included, everything's paid for, which is never the case with Medicare, as you find out once you get on the health insurance. So Part A is your hospital coverage. Most people get this for free. It depends on your work history, but most people earn this for free. And it only covers hospital. So in 2026, if you go to the hospital and you only have original Medicare and you are an inpatient for 2 days, you're going to pay over $1,700 for that stay. That's the Medicare benefit. Part B is your outpatient coverage. So that's your doctor's visits, your emergency room, your preventative care. For a regular doctor's visit, not preventative, you have to meet that $288 yearly deductible. Then Medicare covers it 80%, you pay 20%, which would then go to your other insurance, but we'll talk about that. Premiums for Part B. So if you're on Part B, you pay out of your Social Security checks or you're billed quarterly. The premium for Part B is going up to $206.50 next year. That's for new Medicare enrollees. If you're already on Medicare, it's based on your cost of living increase for your Social Security. Part D, as in dog, is prescription drug coverage. You don't automatically get that when you get your red, white, and blue card. You have to sign up for that. So Part D has its own formularies, pharmacy networks, dependent on who's the carrier. I will say, if you have our classic blue plan, if you have our Medicare supplement plan, you don't need Part D because you have what's called credible drug coverage. It's equal to or better than Medicare coverage. You don't need to enroll in a standalone Part D plan. Just going over the components of Medicare. And Part C. So if you were paying attention, it went A, B, D, kind of missed a letter there. C is Medicare Advantage plans. Medicare Advantage plans is that other path, right? So it replaces your Medicare coverage. So if you were to go on the Plan 4, the MAPD Plan 4 for next year, you would only show that card when you go to the doctor, the pharmacy, and the hospital. Your red, white, and blue card, very important. Leave it at home in the safe. You're not going to show that to providers anymore. Medicare Advantage plans rely on their own networks. And I will talk about that a little bit with the Medicare Advantage plan that's being offered because it's a little different. It's an employer Medicare Advantage plan, not a standard one. So it has a bigger network in that sense. But Medicare Advantage plans live by Medicare rules. They have to cover equal to or better than original Medicare. And they have to cover a lot of the same core benefits. And they normally add on things, dental, vision, things like that, makes their plan more appealing and helps keep their enrollees healthier longer. We don't offer a Medicare Advantage plan. Because we're a consortium, we can't build a Medicare Advantage plan. We can't directly contract with CMS to create one. That's why we don't offer one. If we were to offer one, it means that we're actually pushing our members out of the consortium where premiums would go to a fully funded plan, which we don't want. We want that risk pool to be together, paying premiums together, incurring claims together, that type of thing. So how does a Medicare supplement plan work? Exactly what supplement means. It supplements where Medicare leaves off. So if you go to the hospital and you get billed that $1,700 bill for your 2-day stay, inpatient stay, the supplement plan picks it up. If you go to your primary care doctor and you have that $288 deductible that's not met, the supplement plan pays it. It picks up where Medicare leaves off to give you 100% coverage for any Medicare provider, as long as it's a Medicare covered service. We also have, we've added a few things to our Medicare supplement plan. We have a rider for vision coverage. We have a rider for hearing aid coverage. If you were to go on the open market and pick out a Medicare supplement plan, you're not gonna get those benefits. You're also not gonna get drug coverage with it. The other important thing about Medicare is once you're on Medicare, you become an individual. So you retire, you're on your family plan. Once you have Medicare, you have individual Medicare coverage. Medicare doesn't have a family plan. So our Medicare supplement plans work the same way. If you're the retiree and you have a spouse, you become individuals and you both get your own Medicare supplement plan policy. The Medicare Advantage plan works the same way, where you'd have two separate plans, same coverage, but you'd have your own ID cards, not family. So I always mention this slide because people are like, what about this? What about that? Think about how you're using your health insurance on an annual basis. How many times did you go to see your primary? How many times did you go to a specialist? Did you have something major happen and you wound up in the hospital for surgery? What did those bills look like or not look like? Did you have an issue finding a provider? Did you have to change medications because you needed a prior authorization? Things like that. Think about how you're using your health insurance, because those are the important questions that you're gonna want answers to, versus just the overall benefits that I'm gonna go over in a minute. So I did put the cost up here. No, this is not what you're going to be paying. This is what we bill the city. So the classic blue, per individual, we bill the city over $1,600 starting in 2026. Family plan is over $3,500. Yeah.
I have a question, on the previous page, number 2, the Medicare supplement plan is individual coverage only, so the city will pay so much of it, like, my husband's retired at 13%.
Right, so the way it would work, so this is a great slide for that, actually. So right now you're on Family Classic Blue. I'm just gonna guess and assume. So Family Classic Blue, $3,500 a month. So if you were to go to the Medicare supplement plan, it'd be 2 individual plans, which is $1,200 times 2 that the city's gonna pay. Then you pay your cost share, which is the 13%, 20%, depending on what you negotiated in your contract. It applies for the spouse too, but if you do the math and just add up the totals, you're comparing $2,400 for the both of you versus $3,500 total that goes to the city. So there's still a cost savings there to the city, which then would result in a reduction in your cost share because it's a lower base amount that you're taking that percentage out of.
Do you know what this thing's paying right now for the classic blue?
To- Total?
Monthly, no, like for an individual.
Yep, it's right up here. So an individual classic blue is 1,641. This is on page 12 of the slides.
Yeah.
As well. But for an individual, they're at 1,641. So
2025 numbers?
26. So in 26, the Medicare supplement plan will be 1,217. And then the Medicare Advantage plan, plan 4 would be at 583. Individual.
Is that still through Excel?
The Medicare Advantage plan? The Medicare supplement? Yes. So all of our plans through the consortium are through Excelis, which means it's the same provider network. And we'll talk about that in a minute, where actually the Medicare supplement follows Medicare's network, which is even bigger than Excelis when it comes to a national network. So as long as they take original Medicare, they take your supplement. So if you go to some place that is out of network with Excelis, but accepts original Medicare, they automatically will accept the Medicare supplement plan.
The prescription coverage, like most of us don't get it through Medicare because it's credible coverage.
Right.
So is this still gonna be credible coverage that we're gonna have still?
Yes, ma'am.
Okay.
Yep. Yeah, you do not need to pick up a Part D plan at all. So when I talk benefits, the big thing is you need to see how Medicare's paying, then see how much the Medicare supplements plan is paying. So I kind of put that up here, original Medicare, they have a deductible. With the Classic Blue, it works a little differently than the Medicare supplement plan. So Classic Blue is not a supplemental plan. It's a secondary plan. Which means Medicare pays their piece, then Classic Blue gets the remainder and says, okay, they haven't met their $50 deductible, so they're gonna owe that. Or Medicare covered equal to or better than our coverage, so we're not gonna pick up until they've reached their max amount of pocket. So a lot of times what I hear from people is I get small bills at the beginning of the year and then I don't get any bills when I'm on Classic Blue. That's normal. That means you've met your deductible. And that means that you've then later on met your maximum out of pocket and you have 100% coverage after you reach that maximum out of pocket for the year. Medicare supplement doesn't have a deductible you need to meet. It helps pay for your Medicare deductible. And you have that coverage starting January 1. So you're not going to see little bills at the beginning of the year. You should see no bills. As long as you're doing a Medicare covered service, like going to see your primary doctor, whatever, it'd be covered at 100% between original Medicare and the Medicare supplement plan. There's also no max amount of pockets on Medicare, which is kind of scary if you only have your red, white, and blue card and nothing else. So that is why the Medicare supplement plan also has no maximum out of pocket. It'll just keep paying and paying. As long as Medicare is footing the first part, the Medicare supplement plan picks up the balance. It's also why your Medicare Advantage plan doesn't have a maximum out of pocket either. So you're gonna have that continuous coverage throughout the year. You're not gonna have to add up to something. Which under the Medicare Advantage plan would be pretty hard to do considering all the copays are zero. So we're looking at 3 plans, but the options next year, from what I'm told, I know City Council hasn't voted yet, would be the Medicare supplement plan and the Medicare Advantage plan. So those far 2 right columns is what we're looking at to compare covered in full, covered in full. The Medicare supplement plan lets Medicare do their job of covering most of the claims and then just will keep picking up those balances.
So
Yeah.
no more basic,
Classic Blue, that's the move that they're looking to make, is away from Classic Blue because it's pricey.
So it won't be available at all.
That's,
We're waiting on council to vote.
thank you. I was like, that's what I'm told.
That's what we're waiting.
Okay. One of the things I just want to point out here, when you look at adult routine physicals, ironically, Medicare does not cover these. They cover a wellness visit. And if you call your doctor and say, I want my annual physical and not say wellness visit, then you could wind up with a bill for them because Medicare doesn't pay for it. Therefore, the Medicare supplement plan doesn't pay for it. It's verbiage. So just make sure when you're calling to make that appointment, you're making a wellness visit. Versus the Medicare Advantage plan does cover annual physicals in full. You don't have to worry about what words you're saying to your doctor. I know. I just like to point it out because I always get that phone call. I just got a bill for $250 and I saw my doctor for 15 minutes. Did you tell him it was an annual physical? And normally the doctor's office is good about changing it. But
So is an annual visit if you're on Medicare? Every time you go annually, it's a Medicare wellness visit.
yeah, you want to call it a wellness
If
visit.
you go every 6 months to your doctor.
No, that's more like a primary care visit. And that is covered by Medicare. You have to meet your deductible, then it's covered at 80%. Then the deductible and the remaining 20% would go to the Medicare supplement plan and be picked up in
That's
full.
covered by us.
Yep.
Appointment for an issue.
Yep.
It's not a wellness, it's.
Yep.
It's an issue.
That
It's covered.
it's covered. Yep. Medicare covers all of those things. Seeing specialists, going to the hospital, x-rays, lab work, all of that stuff. It also includes urgent care. Emergency room care is a little different with Medicare. Not that I've ever seen a hospital that's out of network with Medicare. They normally don't want to be. They make good money off of Medicare. But if you wound up at a hospital that doesn't take Medicare, it still would be covered the same way as if you were in network. That's the emergency care rule across all Medicare plans. And the Medicare Advantage plan works the same way too, of covering that whether you're in or out of network. So you have that nationally. The other one I always like to talk about is skilled nursing facility. A lot of people think that's like long-term care placement, like I'm gonna live my days out here. That's not what skilled nursing is, it's acute care. You fall, you break your hip, you need inpatient rehab to get your strength back, because you have 3 steps into your house and you can't do it yet. That type of thing, that's skilled nursing. First 20 days of skilled nursing are covered in full by original Medicare. After that, you actually have a copay per day up to $204. I think that actually went up. Per day, up to 100 days. The Medicare supplement plan will pick all of those copays up until you max it out at 100 days. PT, OT, and speech. So you finally get home and you need to go to your physical therapist twice a week and you're not sure how long it will be. There are no caps to physical therapy or occupational therapy under Medicare anymore. If they try to tell you that, have them call me. They're not following the rules. The Medicare supplement plan will pick up that 20% as you continue your outpatient PT as well. There is no limit or number of visits or anything like that. Durable medical equipment, right now, under your classic blue plan, you have to meet your deductible and then it's covered at 80% and you pay a 20% co-insurance. A lot of people I work with see this when they order their CPAP supplies. And then they're getting those bills in the mail from Edge Park or wherever. If you combine original Medicare with the Medicare supplement plan, you have 100% coverage for that. Medicare pays their 80%, the supplement picks up the balances. There's also, original Medicare does cover chiropractic care. I think last year when I came out, had a fun conversation with somebody about, well, my doctor says that Medicare doesn't pay for that. It's because your doctor doesn't take Medicare. It's a fun little way they reword that for you. And I actually helped them self-submit claims for that. So Medicare does cover chiropractic services, and then the Medicare supplement plan would pick up those balances. You just have to make sure you're going to a Medicare provider or that they accept Medicare to make sure those claims are getting sent in. And there's also acupuncture coverage, where Classic Blue doesn't have any coverage for that benefit.
Can we back up just a minute?
Yeah.
To the skilled nursing
Skilled-
facility?
Yep,
So. You're saying the MS3 would cover up to 100 days
yep,
after Medicare kicks off,
yep.
then the supplement will kick in. So over 100 days, say it'd be there 140 days. That 40 days is out of pocket.
Yes, most likely, yes.
Is that something the city is gonna pick up? Because they said they would pick up all costs that would be covered under blue.
Right, because the Classic Blue covers 365 days.
Right. So is that something the city would pick up?
That is, we're waiting again for council to vote on the resolution tomorrow that's supposed to lay all that out, so.
I mean, I have to be
They
honest,
have said that's what their intention is, so that is my understanding, but I have not seen the vote on it.
we did some studies on some of our other plans for skilled nursing. Because we were increasing the visit limits on it and we weren't seeing people reach 100 days. Because hospitals don't want to keep you, they want to send you home. The other piece is you have to be progressing. So skilled nursing is also, you're there to get better. If you're not, if you've plateaued and really the decision is placement or home with home health care 24/7, Medicare is not going to keep paying for your skilled nursing either. So, and neither would the Classic Blue. They follow those guidelines. You can't just sit in skilled nursing. You have to be progressing towards getting home or being placed.
So what is?
Skilled nursing is short term. It's not, I have dementia and I need help with my medicine and my ADLs and my IADLs for the rest of my life. That is not skilled nursing. That is long-term care. Skilled nursing is, I need inpatient rehab. to help me get stronger so I can go home. Or I'm unsteady on my feet and I'm gonna have another fall. We need to build up those abilities to get you home. Yep.
Just want to comment too. We just looked at the council agenda. You don't see it on there for tomorrow. So it's didn't quite on me.
I'm aware. I sit in my chair.
This next slide is kind of what the additional benefits that were added to the Medicare supplement plan, which is a routine eye exam, $100 eyeglass allowance, diagnostic hearing exam, and hearing aid coverage. Now, if you compare it to the Medicare Advantage plan, the Plan 4, you get a richer eyewear benefit with them. It's a $300 eyeglass allowance. And they do have hearing aid coverage, but it has copay rates. Those, the $4.99 and the $7.99 are copay rates you pay. Versus the co-insurance. Which one's better? Depends on the price tag, right? So, depends on how much they're billing for your hearing aids versus, you know, all that stuff. The other piece is with the Medicare Advantage plan, you have to go to a true hearing provider. There's multiple around here. I've looked. But just a heads up, if you don't go there, you don't have the benefit. You have to go to true hearing versus the Medicare supplement plan. As long as they take Excelis, they'll bill your hearing aids and then they'll help pay for that piece.
I don't, question, the adult routine vision exams yearly.
Mhm.
I know we go once a year now. And it does cover like all of our, and the class, I don't remember, she said it's Medicare, the class blue, it's covering all the exams except for a refresh.
Yes, so great question. You have coverage now, so what's the difference? So an adult routine eye exam is refraction. The other piece is puff of air in your eye that's torturous, to test your pressures, glaucoma screenings, cataract screenings, that's all medical. That is covered already under your current coverage and will continue to be covered under these plans as well.
Medicare is
Medicare will pay for cataract screenings, glaucoma screenings, those types of medical screenings. But when it comes to your refraction, you know, do we need to tweak your eyeglass prescription? That is not covered under Medicare, original Medicare.
What about regular vision tests when they check your eye pressure? Is it all considered?
That's glaucoma testing. Yep, so that's medical. So that's why a bulk of probably what you're having done is getting paid for, except refraction. So under the Medicare supplement plan, it'd pay for the refraction and you'd have a $20 copay.
So pay for everything for $20.
Yep. Yep. So pharmacy coverage, across the consortium plans, which is the classic blue and the MS3, we use the same drug formulary, which means if you're on a tier 1 medication under classic blue, it's going to be tier 1 under the Medicare supplement plan. It also means that the prior authorization requirements are the same. So if you have a prior authorization right now under classic blue, that would just transfer to the Medicare supplement plan. And the copays are the same as you have right now under classic blue. The copays for the medications would be the same under the Medicare supplement plan. And when I say copay, that's the most you're gonna pay for that tier. So if a tier 2 medication is, the drug cost is only $15, but your copay should be $25, you'll pay the $15. If the drug cost is below the copay rate, you'll pay the lesser amount. That's how our plans are set up. And if you get the medications through mail order, you're gonna pay the 1 month copay times 2 instead of times 3. You can continue to get 90-day fills of your medications at a retail pharmacy under the Medicare supplement plan, but just know you're paying that copay rate, a 30-day rate times 3. Yeah.
I thought with our 90-day rate currently, we're only paying one code.
You pay 2.
We're paying two.
Yep.
Medication is really expensive. And I've had one that I'm on right now, I guess it's expensive, and we have the tier 1 $10 copay for like 1 month's worth. pay $17 and some cents.
That would remain the same. It's the same drug formulary. The drug costs would be the same tiers would be there. Now, the Medicare Advantage plan does have lower copays, but it's a different formulary than what you have right now, which means the medications are tiered differently. Which is not something that's normally micromanaged by anybody. Because it involves Excellus negotiating pricing with drug manufacturers. I did put this in here. I will email this out to Chrissy so it can be put up on the website because it is hyperlinked. I've gotten a lot of phone calls lately from retirees wondering, where do my drugs fall if I go to the Medicare Advantage plan
That posted
versus?
already, yeah.
So this
Not
puts them
this slide, but
both
yeah.
in the same spot.
Okay, perfect, thank you.
So you can look at our drug formulary for next year and you can look at the Medicare Advantage Plan 4 at the same time. To make sure that the meds will be covered if, depending on what plan you're picking. But just keep in mind, if it's covered now under Classic Blue, it will continue to be covered under the Medicare Supplement Plan. The other piece, drug formularies are made up of tiers, tier 1, 2, 3, what have you. It's also made up of prior authorization requirements, quantity limits, and step therapy. No, I'm not going to quiz you on what those things are, but just know that they're different under the Medicare Advantage Plan 4. So some of the meds we require auth on, they may not. Some of the meds we don't require auth on, they may. So you might have, some transitioning of those things. All of the plans I'm showing you use the same mail order pharmacies. So if you're getting your meds through Express Scripts or Wegmans Home Delivery right now under Classic Blue, all you'd have to do is call them with your new ID number in January. No new prescriptions, no changing of pharmacies. You just need to give them your new ID card. I would highly recommend waiting till January 2nd. I can't tell you the phone calls I get between Christmas and New Year's saying the pharmacy won't cover my meds. Did you give them your new card? Yeah. Yeah, it doesn't start till January 1. So just make sure to give it to them after January 1. The other program we have available right now to you under Classic Blue continues on for you if you choose the Medicare Supplement Plan is Canada RX. Canada RX is not part of the health insurance, but you gain access to it by being a member of the consortium and being on one of our health insurance plans. Canada RX is a voluntary prescription drug program. And they cover a wide range of name brand medications where they can be mailed to you at a 90-day supply and you pay 0 copay. So I've had great success for people who are on inhalers, rescue inhalers. You may be on albuterol, you could go on Ventolin, which is the name brand of it, and get it for 0 copay. Eliquis is huge. That's a tier 3 medication under our drug formularies. And under CanRx, you can get it for 0 copay. So instead of, I think it's 80, whatever the copay is up there at tier 3, it'd be nothing out of your pocket. I have helped a few retirees get on this program and it can help save a good deal of money on your medications. It's awesome. This is just a snippet of the amount of meds. I mean, the list is very long, so I normally encourage people to go check out their website and look up your meds and see which ones they have available. I throw this in here whenever I'm talking to retirees on Medicare. If you are looking to shop around outside of what the city has to offer, I know, add one more thing. But if you're looking to shop around, I always refer people here. It's called High Cap. It's in New York State. This is the only free, unbiased Medicare counseling you can get in the state. Everyone else is trying to sell you something. They don't work on commission. They work for Office for the Aging and different networks like that. If you're looking to get free, unbiased Medicare counseling, this is a great avenue. I actually worked for them for 8 years, so shameless plug. So they do a great job at comparing Medicare plans and talking you through all your benefits. I'm also throwing this in here because I can't help myself. There's a program available to anyone on Medicare who's paying for their Part B. It's called the Medicare Savings Program. if you qualify for this program, it will put the Part B premium back into your pocket. So if you're interested in looking into it, there's a hyperlink here. You can also contact, what is it, Department of Social Services locally, but they're the ones that carry the application, or Office for the Aging. They have them available as well. But it's a great opportunity to put money back in your pocket that you're paying out for Medicare. Any premiums you're paying on health insurance reduces your income to qualify for this, except your Part B. So whatever you're paying for your retiree health insurance reduces your income to help qualify for this. And lastly, this is my direct contact information. I also have one other person in our benefits department. Her name is Jess. She's fabulous. So I put her phone number up here as well. And this email address is only shared by Jess and I in the benefits department. If you have benefit questions, you're more than welcome to reach out to us. I'm gonna take a breath and see if anyone has any questions.
We take the MS3,
Mhm.
we'll have our cards by January 1st.
Well,
Be covered under.
I always say yes to that, but I'm going to say,
Of the city.
Chrissy and I have talked, and normally open enrollment ends for the consortium at the end of November. Now, I'm aware that the city council still needs to vote on things. And then I may be assisting Christy in some of that manual entry of retirees. So my goal is to have a card in your hand by January 1. And I will do my darndest to make that happen. But if you don't, I can email it to you. I can tell it to you over the phone. You will have an ID number. It's just the cards take a little longer because they get printed at Excelis.
You might have now, so it's over.
Are you doing automatic rollover or do they have to elect?
It's on something.
So again, this is part of that resolution that we're waiting on, that
Okay. So in a normal world, I would say you don't need to do anything. It'll just roll to next year. But an employer can tell you, elect to say, if you want to stay where you are, you have to fill out this form to tell us you want to stay where you are. And I don't know if the city is doing that or not.
And we would have to do that by before December 31st.
a lot further before. that.
Yes, it would be more like the end of this month, I would hope, but Christy and I have talked about it. We understand that may not be possible. I mean, we all know the postal system is a little slow on sending things, so.
So the deadline that was originally talked about was December 15th for open enrollment. Now you're saying it's November 30th?
That is the consortium's request to all municipalities, is that they close open enrollment by the end of November. Now, is that always possible? No, definitely not with this many unions that we cover. So that gives us the first week in December to finish up all of our data entry. We at the consortium do data entry for about 65 of our municipalities. So that gives us a week of leeway, but the following week is a little late because we normally mail cards that week. So December 15th is a little late because we normally mail the ID cards that week.
Still is the deadline, but you want everything.
If the city set the deadline there,
Well, we haven't yet.
Oh,
There is no
okay.
deadline set yet. There's
Okay.
no resolution yet that's been voted on, so there is no.
Okay.
deadline. Until we get that, we can't give instructions from our department.
okay. So in my world, it's a little late. Doable, sure, just means I'll be doing more taking.
Was this definitely being offered to us or are we waiting for the council?
This is already being offered. This started being offered last year. We currently offer it as an option.
We don't have to wait for the council to vote on anything. If we decide we want to go with this.
I will defer to the council on that because I am hesitant to say anything and then be contradicted. How is that? My understanding, again, all I can give you is my understanding until I see it in writing and they vote on it. And I don't have that yet. I've seen drafts, but things change. My understanding is that the intent is that they are going to offer the option for all of our post-65 retirees to either choose the MS3 plan or the Plan 4. That is my understanding. And then that is my again, that is my understanding.
Agenda for the insurance could bring me in the agenda. We're just waiting on that.
Yes. Did you- Me? Nope, back here. Yeah, I'm looking at you. Yes.
Wasn't sure. So if I understand, if the council wants to do this. Is the city gonna take care of all the paperwork and roll us over to that, or we have to come and say, yes, I want this.
Once we know what the options are, we are gonna send out instructions with everything on it, and we will, yes, you're gonna have to tell us what you want, because there will be options, so. What that looks like right now, I can't tell you.
Oh,
Yeah, sorry, I feel really bad because I keep saying, I don't know what to send out until I'm given direction. So that's where I am right now.
We're on Facebook, a couple of them, and one of them was printed up and we're concerned about this. Number one, that the eligible retired Medicare enrolled individuals who are currently enrolled on either Classic Blue or MS3 for the 2025 plan year shall be transferred to Spanning Plan 4 for the
So-
26 plan year and be provided with a special.
That is not correct.
Into the MS3.
Right, so that's not correct. That was the initial draft that the attorney had given, the very first draft that went to Mr. Goler. And it is not correct. I think there have been at least 2 or 3 iterations since then, which is why I'm saying I don't want to give information that is then wrong 10 minutes from now. So
okay.
when the resolution goes in front of council and gets voted on, that's what we'll do. So, and things keep changing.
So it made it look like we were gonna be enrolled in Spanning first, and then we would eventually be allowed. into
Yeah, that would make it no sense, right?
Right,
So,
yeah.
How about our partners? Like my wife, you'll automatically, when you send out this information.
yes, it'll go to everybody who's,
Yeah, what about the
Currently on.
employees that have children under the 26-year-old? Does any of this apply?
there are, I think, 1 or 2 after 65 retirees who have a significantly younger spouse and or children. So they will be dealt with as a different case scenario.
So would they
because-
fall under the bronze plan?
Yes, that is, my understanding is that they will then stay as a family under the bronze plan, so.
Still have a bank that you.
The banks are
Okay.
still being applied, yep.
Bill, can I ask, what's going on with the resolution?
Andy Jewett's in the back office, is supposed to give me the resolution now, I was gonna share it with you guys, but we don't have it yet, he's gonna print it all.
Does it appear on the agenda? Is that gonna affect whether it's presented?
No,
It can be added from the floor, anything can always be added from the floor, so.
Yes.
No one knows what the resolution says up until the very last minute. How can that be voted on?
we're gonna get it, I'm trying to get it right now to share it, so I'm just waiting, it was probably 30 minutes ago.
Not on you, Bill, but like, how does a resolution come to the floor with all these concerns? And it's not even in place yet a vote was expected tomorrow night.
Well, there's a way we could table it, if it's not up to satisfaction, is a way to table it, so we can probably table it next time.
If it gets tabled, how does that affect us being some enrollment at some point? Are we still in class with Lou until this is resolved? Right.
Again, this is all, it's all conjecture until we get to tomorrow night, so I would say come tomorrow night and listen and.
It doesn't get public, does it still? Why not? It's still nice.
I don't know, that's a great question.
You had a question?
The MS3. It's still out of network.
Yes, great observation. So the MS3 does not have out-of-network benefits because it follows the Medicare network. So as long as they're accepting Medicare, there is no out-of-network needed because it just follows Medicare. The only time you'd really have to pay attention to make sure they're taking Excellus is for your routine eye exam, your eyewear, your hearing aids. Those have to take Excellus for the rider. So with the Medicare Advantage plan, when you look at their benefits, I don't know if you sat in on any of their presentations. They show in and out of network at 0 copay. They follow the Medicare network. So if you go out of network with Medicare, neither plan will pick up.
What about referrals? How do they work?
They're very rarely required by Medicare. I can only think of maybe one, which is for motorized DME, that you have to get a referral because you have to get a home assessment. They're very rarely needed.
Oh, I have a question, but you would probably help me with this. I get confused when we see our insurance premium.
I'm sorry, I didn't realize you were talking to me out of it.
When we pay our insurance premium monthly, we get billed, right? So for the December first bill, when we pay that, is that for December?
No, it's always for January. You always pay a month ahead. Yeah, so we don't know what we're billing yet either.
Okay,
Yeah.
so if I come in, I'm gonna.
Yeah.
come in Any day, to come pay the December bill. I'm actually paying for,
You won't have a December bill until we know what we're doing.
I have one. December first, it's dated December first. 2025, I got it in the mail with that letter.
Oh, okay, well, I don't know I don't know, which numbers she used.
Well, if I pay that, if I come in and pay our premium on that, does that mean I should have classic blue in January?
No, we're waiting, we gotta wait on the council to make their decision, so we know which plans we're signing everybody up for, so that they're enrolled in the correct plans.
So don't pay that bill until we find out.
I would say hold that bill until we know a little bit more of what's happening. I'm sorry, I can't hear, there's like 4 people talking at once and I'm slightly deaf, so.
If there's automatic payments,
Automatically.
Yeah, and then there's, you have to change that every year anyway, when the amounts change every December, right? Because the actual deductions change every year, so. Just hold, I would say hold for now until we know what
It was taken out automatically. Saying she's paid it already for January. The bill I reimbursed this letter showed my deduction.
Okay, and again, we'll make adjustments as needed. Chrissy tracks everything, and if somebody's either over or underpaid, she'll let you know and we'll make the adjustments. So,
So what card are you going to say? No.
so it depends which plan you go to, and you'll still have 2 cards.
so if you go to the MS3, you're still gonna wanna show your original Medicare card like you have been. And then you just show your new MS3 card, and those are your 2 cards. If you go to the Medicare Advantage plan, that's the only card you'd show.
That's a PPO, it's all rolled into the one managed by Excelis, so that's the only card you need. So there,
Excelis card.
well, the PPO is Excelis as well. That both of them are Excelis plans. So it's all still Blue Cross Blue Shield, it's all still Excelis. It's all still employer sponsored. It's just, there are the differences that she was talking about. And this is where it really relies on people to look at their personal medical usage and understand what you use and which plan makes more sense for you. Because for some people, one plan will make much more sense than the other. And for other people, it might be the opposite, right? So, and without knowing somebody's own personal usage and especially their prescriptions and what they do and don't pay copays for, and then double checking those formularies. It's all very personalized, right? So there's not a good, one size fits all. And that's why we were trying to look at options that would give people the best option for their own personal circumstance or the best cost. And it is very complicated. And that's why we keep giving handouts and links online and informational sessions, because we want people to understand what is the best fit for their specific situation. And I wish there was a quick, easy answer, and there's just not.
I see you. Yes, what's your question?
Would the MS3 still be considered commercial insurance? So the reason I'm asking is I have a savings card for one of my prescriptions. And under the current one, I can use the savings card.
Nope, I understand what you're saying. Is it a Part D plan? Yes, because you can't use that card if you have a Part D plan. No. Our MS3 drug coverage is not a Part D plan. It is commercial drug coverage. You can still use your discount card. If you go to the Medicare Advantage plan, that is a Part D plan and you can't use it. That's a great question. Not many people know that.
Yeah, yeah. But then there's the 011, so depending on the formulary, it may or may not, what I'm
It
saying?
may be
Yeah.
covered anyway.
Yeah.
Were there other questions about the Medicare supplement plan or how Medicare works?
On an MS3 card, will it say RX on the card?
Yes, yep. And it'll show your co-pays. Yep.
So we need to return tomorrow night. To hear what the. council-
I would recommend it. I think it's always better to be informed.
Same time as.
6, yes, 6 is the council, yeah, yep.
And if you had someone that missed this evening session, I am back here tomorrow at 10 a.m. Or you're welcome to come back and hear it for a second time, but just so you know.
And also we'll put the link online as well, like we've been doing with the other ones. So.
Thank you so much.
Thank you.